Hi, my name is Dr. Hannah, and today I'm going to talk to you about heartworm disease, which is very common here in Texas. Heartworms are a common and devastating parasite here in Greater Houston and all of the southeast United States. Heartworms are contagious but only spread through mosquitoes. The mosquito must bite an infected dog, suck up a baby worm, which grows in the mosquito. Once it reaches a certain stage of development, the heartworm is injected into a different dog when that mosquito bites that dog for a blood meal. The baby heartworms circulate through the dog's bloodstream until it reaches the heart. Once there, it can live up to 7 years. The adult worms mate in the heart and have babies that will be sucked up by mosquitoes, perpetuating the cycle. A dog can get infected with multiple worms. Some dogs have had over 100 adult heartworms in their heart when they die from end-stage heartworm disease. A good question is, how do I know if my dog has heartworms? Dogs over the age of 6 months should have a yearly blood test done at a vet clinic. This is a simple test done at the clinic and costs about $30. It will tell if your dog has heartworms or not in about 15 minutes and uses just a few drops of blood. This test should also be run if you've missed doses or have been late on giving your dog heartworm prevention. What signs are there that my dog might have heartworms? Heartworm infections start out insidious. This means we don't know that the dog has an infection until there are a lot of worms and irreversible damage to the heart and lungs. At first, you might notice your dog has a bit of a cough or gets winded easily. This will progress to chronic and frequent coughing, extreme lethargy, and eventually congestive heart failure. This can lead to complete organ failure and death. This can happen in dogs as young as 5 or 6 years old with a large number of worms living in their heart. Your veterinarian will be able to discuss doing a test for heartworms on your dog if you are concerned. Treating heartworms is expensive and time-consuming and hard on the dog. The recommended method is a multi-step process involving antibiotics for 30 days, followed by a series of injections given deep into the back muscle. The dog must be kept quiet and have no exercise for 30 to 60 days following the injections. And if a dog has been treated for heartworms, it can still get them again unless they are kept on prevention for the rest of their life. Cats can also get heartworms. They are not the preferred host for the parasite, but it is possible for cats to become infected, especially here in the Greater Houston area and the southeast states in general, because of the prevalence of this parasite. Just like in dogs, heartworms can be fatal, but in cats, even one heartworm can cause death. There is no treatment for heartworms in cats. Prevention is the best policy. The good news is that there are many ways to prevent heartworms in dogs and cats. There are a variety of oral preventatives, usually given once a month, that are very inexpensive. Heartworm prevention can cost as little as $10 a month, and they are almost 100% effective at preventing your dog or cat from getting heartworms. Additionally, some of these medications have a dewormer in them as well, so they do double duty preventing intestinal parasites. There are some combination medications that make life even easier in that there is a flea preventative alongside the heartworm prevention. When given monthly to your dog and cat, they are protected against fleas and heartworms and intestinal parasites. As you can see, prevention of heartworm disease is much better than treatment or death from heartworms. We know that dogs living in this area who are not on prevention will likely get infected by heartworms. We also know that it is easy and inexpensive to prevent heartworms in dogs and cats. I encourage you to talk to your veterinarian about which options are right for you and your pet. Thank you so much for watching.